Hi, my name is Dr. Kate Greasley and I'm a lecturer in law at University College London. And most of my work for the past few years has focused on the law and ethics of abortion. And I'm particularly interested in the question about when, in the life of an early human being, that human being acquires the status of a person, or in other words, becomes morally important the way you are and the way that I am, and gains the strong right to life. So the story I want to tell is a thought experiment which relates into that question, and it's called the embryo rescue case. So in the embryo rescue case, you are facing a dilemma. You are in a burning down hospital, and as you're running out of the hospital toward the fire escape, you see that on the one side of you there are 5 frozen human embryos in a canister, and on the other side there's a fully formed human baby. Now, because of some complication, you can only save one or the other, the 5 embryos or the 1 baby. Now, most people would say, when faced with this dilemma, that of course, without question, you must save the 1 baby, not the 5 embryos. But that tells us something very interesting about the relative moral importance that people assign to babies versus embryos. And that's because in decisions about whom to save, when all things are equal, generally speaking, we should always save the many over the few. Here, the embryos are the many, and the baby is the few. So if they were of equal moral importance, you should save the embryos rather than the 1 baby. But that's not what most people think. So the general value of thought experiments like this in abortion ethics is to tease out the underlying beliefs and commitments that people might have, possibly without even realizing it, but which seem to then be implied by their visceral reactions to these sorts of hypothetical cases.